Did you know that there's an online program specifically designed for people suffering from chronic knee pain and those that have had a knee joint replaced many months or even years ago? It's called the Failed Knee Replacement Recovery Program, and there's a link to learn more about it in the description below. Let me share with you 9 reasons that this program may be right for you. Reason number 1 is if you suffer from chronic knee pain and you've already finished all your physical therapy treatment you were supposed to do, you've already gone through all the follow-ups with your surgeon, and your knee just isn't right, you're still having pain, even though the surgeon and the physical therapist may be telling you, well, everything's normal, you're bending normal, you're straightening normal, you're walking, you're doing things, but you're not content and you still have problems with your knee, then this program is going to be right for you to take a look at. What you've got to realize is the surgeon and the physical therapist that helped you after your surgery, their specialty is in doing surgery and in doing recovery from surgery. And it's very likely the case that you have another problem. It's usually something called a muscle imbalance, which I'll talk more about in a moment, that you're suffering from, and that is a different specialty required to treat that problem. That's what I specialize in. So you've reached a point where you've maxed out the knowledge and specialty of the surgeon and the physical therapist, and it's time for you to look at a different treatment approach to fix that chronic knee pain. Reason number 2 is that you're not getting better with your current treatment. Very often, people that have chronic knee pain after having gone through all the treatment up front to recover from the surgery, they're going through another round of physical therapy, or they may be doing pain management treatments, and these treatments may not really move the needle on making the pain go away. Maybe temporarily, but keeping the pain down or even gone for the long term, it may not be improving that situation. It goes back to you're not seeing the right specialist for the specific problem that you have that's still bothering you. If you've been doing some treatment and it's not effective, it's time to change your treatment approach. It's time to change plans and try something new. The Failed Knee Replacement Recovery Program will show you a variety of different treatments that you can do and exactly how to do it. And most importantly, it'll explain to you when it's the right time to do certain treatments, because there's certain treatments out there for people suffering from chronic pain after a failed knee replacement that are good, but done at the wrong time, they're going to come off as something painful or not helpful for you. But if you do them at the right time, they're going to be extremely effective for you. And number 3 is treatment that doesn't hurt. Very often after you have a knee replacement, it's painful. I mean, it's just the nature of the situation. You were cut open, bits of bone were taken off, metal implants were put in, plastic parts were put in, and then you have to heal from it all and get back to walking right away, right afterwards. So it's naturally going to be painful recovering. You should be on pain medication to mitigate the pain, but it still tends to be quite sore and uncomfortable in the weeks and even months after having the knee replacement. The treatment that you're going through at that point is supposed to be painful. But if you've already recovered from the surgery, now the treatments at this point should not be painful. They should in fact be getting rid of the pain. The whole no pain, no gain mentality does not apply anymore after you're done recovering from your knee replacement surgery. If you're doing a treatment right now and it's been many months since your knee replacement and it's painful for you, you need to consider doing something different, because your treatment right now should be helping you get rid of the pain. Reason number 4 that an online program like the Failed Knee Replacement Recovery Program is going to help you is because it's focused on addressing the root muscle imbalance. Now, let me explain to you what that means. There's a root muscle imbalance that surgeons don't know about, and physical therapists after doing surgery, they don't know about this either. It's not something that's taught in normal surgeon schools and physical therapist schools. But if you think about the muscles on the front of the thigh, here's the foot, there's the kneecap, here's the front of the thigh, the quadricep muscles, those tend to be overdeveloped, overly strong. They tend to be used for everything. And so when they're overused, they start to add a lot of compression, tension, and pressure into the knee joint. And that's what often causes chronic pain after having a knee replacement. And in order to shut down these muscles and just use them when you're supposed to, use them appropriately, you've usually got to get better strength in the glute muscles behind the hip and even in the foot muscles. That needs to be looked at. Getting those muscles stronger tends to fix this muscle imbalance. Now, it takes a specialist's knowledge to find the right exercises to do at the right time and progress them properly so that you can safely fix this imbalance and normalize the pressures in your knee joint. A surgeon does not know how to do this, and most physical therapists are not well trained in this. They have a concept of it, but applying it is not an everyday thing for them because they're usually helping people recover from knee replacement surgeries or other similar surgeries. So doing a program designed by a specialist at fixing muscle imbalances is probably the right next step for you. Number 5 is that you don't need to travel anywhere. This program is 100% online and it's on demand, meaning you can get to it anytime you want. It's a pre-recorded program, it's not live. So whenever you have time, whenever you want to put this into your schedule, as long as you have an internet connection and a device that can play videos, it could be a smartphone or a computer, a tablet, anything like that, you can begin to watch the videos and apply the treatments that are in this program. You don't have to dress up for anyone and you don't have to spend time and money traveling somewhere. You can just do it in the comfort of your own home, in your bed, on the couch, wherever you see fit. Reason number 6 to do the failed knee replacement recovery program is that you don't need any equipment. Now I say this throughout the program that it's not necessary to purchase any extra equipment and you can still get the outcomes of getting rid of the pain or at least relieving it tremendously in your knee after you've had a knee replacement. Now I do make some suggestions for certain pieces of equipment just to make treatments a little bit easier, but you don't have to purchase them to have the improvements and the success that you can attain to maximize the health of your knee replacement. To be fully transparent, the only equipment that I do recommend you should use is a walker or a cane, and usually if you've had a knee replacement surgery, you have one of those lying around. It might be in your closet, under your bed, behind a door somewhere, or maybe you still use it. I'm going to show you how to use it more effectively so that you can get rid of your chronic knee pain for the long term. But besides those pieces of equipment, you likely won't need anything else. Reason number 7 is that you can use this program to complement something that's already working for you, a treatment that you may be doing that's actually showing improvement, but you want to optimize your current treatment plan and get better even faster or have even better improvements that you've already had. A lot of people get this program in order to learn as much as they possibly can about their knee health so that they're not relying on going back to the doctor or any healthcare providers so that they can know for themselves what to do if their knee starts to flare up again. Reason number 8 is not relying on pain medications. Very often people that have chronic pain after having a knee replacement kind of live on pain medications. They're taking Tylenol, aspirin, ibuprofen, maybe even prescription strength pain medication because they're going to a pain management doctor. You may even be getting injections for pain relief because you don't want to have the revision. Maybe the surgeon doesn't think you're right to have the revision, but you're suffering from knee pain and you're worried about the damage that those medications have on your body. They are known to affect the liver, the spleen, the kidneys, the stomach, and other organs. Doing a program like this might be able to get you to lower your pain down to a reasonable amount, possibly even eliminate it, and get you into a situation where you don't feel like you need any more pain medication so that you can protect your organs for the long term. And reason number 9 is that you can avoid the need for a revision surgery. That dreaded revision surgery, that's where you have to have another surgery to replace your already replaced knee joint. In some cases, it may be right to do this, but in many cases, especially you've been told that your knee replacement is just fine because you've gone back to the doctor for knee pain and they don't want to do another surgery, but you're having problems still. Fixing that muscle imbalance, fixing the underlying problems that have not been addressed can help you get to the point where you feel much more confident in your knee. It doesn't hurt at night, it doesn't hurt during the day, you can bear weight on it better, you can be more active, you can go back to doing things that you love confidently. That puts you in a situation where you're no longer thinking about having to get a revision surgery done. That's what this program can do for you. Now remember, if you want to learn more about the failed knee replacement recovery program, there's a link in the description below. I've also put down there all our YouTube videos in a playlist. It's called the Knee Replacement Help Playlist. You can find that in the description. Please, if you like this video, give us a thumbs up, share this with somebody you think needs to see this, and subscribe to our channel and turn on the notification bell so that you don't miss out on any of the helpful videos we post each and every week. I'll see you in the next video. Bye-bye.